Okay, we are now recording. Hi, everyone. Welcome to Eating Disorders and Veganism, a Conversation. I'm going to briefly read the event description. The discussion of veganism in the eating disorder field often prompts an assertion that veganism is an eating disordered person. An eating disordered person is a form of restriction, and that it is inherently difficult for a vegan person to recover. Relatedly, many eating disorder treatment centers do not offer vegan meal plans, posing unique challenges to vegans in need of eating disorder treatment. Since both eating disorders and veganism are on the rise, it is important that we broaden the conversation at this juncture. This event includes an introduction to Jenn Friedman's book, Veganism and Eating Disorder Recovery. Our expert panelists will explore distinctions between eating disorders and veganism, treatment concerns for vegans, the importance of assessing vegan motivation, and prospective treatment approaches. Attendees will have ample time for Q&A to our panelists. So without much ado, I'm going to start introducing our panelists, and each panelist will have an opportunity to introduce themselves. So we're going to start with Jenn Friedman.
Okay. Hi, everyone. Oh boy. Okay. Thank you, Michal, for that introduction and setting up the house for going forward. We really appreciate you laying the foundation, establishing that foundation for us. So I'm Jenn. It's wonderful to be doing this, with all of you alongside our panelists. So I'm a counselor at MTZ Counseling, and I am also, as Michal said, I've written and published a book called Veganism and Eating Disorder Recovery. I think this event really speaks to the spirit of that work and the fact that, you know, we're having the fact that we're having this event. I think if the book could talk, it would be very proud. It would say, I'm so proud, because this is like really in the spirit of the conversation that I intended for the book to really facilitate and prompt and encourage. And so I wrote that book, and it's really about bringing veganism more into the conversation, kind of elevating it to a place where other aspects of eating disorder recovery are already talked about, but really kind of raising it up and being able to explore many facets of it. I am just more about me. I'm from New York City. I'm from Brooklyn, New York. I currently live in Manhattan. I studied in London for 2 years. I did my master's in counseling there, and then came back to New York and did some more classes with University of Buffalo remotely. And so now I'm doing therapy with MTZ. But yeah, the history there is I have the counseling background. I have also been involved in the eating disorder field, the eating disorder recovery world for many years. I would probably since around 2009 or something like that. In terms of like doing advocacy, I've done a lot of advocacy in terms of performing music. I'm a musician as well, and doing performing or presenting writing and music and speaking at different kinds of eating disorder treatment centers, universities, conferences, things like that. So I've shared a lot. I personally am recovered, so I shared a lot about my own story and kind of the messages from that, the messages about recovery and connection and hope and really having your voice, using your voice. And so that that's sort of my eating disorder piece of this. There's the vegan piece of it. I am vegan, and when I was in treatment, I'll just full disclosure, I was in treatment 2 separate times, and the second time I was vegan but couldn't eat vegan in the treatment center. So that it's kind of stayed with me in a sense, and I didn't really, I didn't really take it anywhere for a while. I didn't ponder too much on it, but it did stay with me, and I think that is definitely a part of what inspired me to really really focus on it now, and really talk about, you know, maybe it could be different, or maybe there could be more support. You know, I started thinking about that, but that was my experience, being a vegan person and an eating disordered person in a treatment center where I wasn't able to eat vegan, and that had an impact. But yeah, no, so I've been vegan for a long time, and I had an eating disorder and recovered now, and I'm in the counseling field, so I kind of bring all of that to the table for this discussion. I also have a creative arts background, and so there's that too. But yeah, anything to do with expression and expressiveness and using your voice, I'm all about it. I love community. I love connecting with other people. So I'm just so thrilled that we're all here together. Really just makes my heart full that we're here together having this conversation, and thank you for being a part of it. So that's me. Oh, Michal, you're muted. Oh,
Thanks, Jen.
okay.
Thank you, Jen.
Yeah,
I
you're
would like
welcome.
to next introduce Lisa Levinson.
Wow. Well, thank you so much for this opportunity. I'm really delighted to be here. It's such a pleasure. So I was actually the movement therapist for the Renfrew Center for Eating Disorders in Philadelphia, where I worked at both the residential and IOP sites from approximately 2002 to 2012. I led a variety of groups, was an instrumental member of the trauma track, and I also ran the spiritual program. Each weekend, I facilitated multi-family groups with 50 people and also co-hosted quarterly family weekends. And on the vegan side of things, I've been vegan since 1995, before I started working at the Renfrew Center. I founded Public Eye Artists for Animals to teach compassion for animals through the arts in 2005, and founded Vegan Spirituality to explore veganism as a spiritual practice in 2009. I co-founded the Interfaith Vegan Coalition to promote faith-based vegan advocacy in 2016. I currently work as the campaigns director for In Defense of Animals, where I run the Sustainable Activism campaign, providing emotional and spiritual support for animal activists. I also offer creative arts therapy at the Iris Retreat Healing Center in Woodland Hills, California. While at Renfrew, vegan patients would ask me for support, so I appealed to then medical director, Dr. Susan Ice, to start a vegan treatment program. I arranged for a vegan nutritionist from the Physicians for Responsible Medicine to address the staff, but Dr. Ice respectfully declined, stating that when the diet becomes more mainstream, then she would consider it. Fortunately, Alsana paved the way for a few years ago with the very first vegan treatment program. I provided an assessment tool and consulted with Alsana as they trialed their new program. So I'm really thrilled to join this panel to explore more vegan treatment possibilities. Thank you so much.
Thank you, Lisa. Next, we will introduce Maria Sorbara Mora will introduce herself.
Hello, everybody. Just wanted to make sure I was not muted. Thank you so much for having me today to join in this conversation, really important conversation. My name is Maria Sorbara Mora. I'm a trauma-informed dietitian, certified dietitian nutritionist, registered dietitian. I'm also an eating disorder specialist and a yoga therapist, yoga therapy practitioner. And I am the executive director of Integrated Eating, which is a nutrition practice. It's a nutrition associate practice, which means that I have a team of about 5 clinicians that work with me. And together we do nutrition consultation, follow-up, yoga therapy, and meal support. So we really are able to kind of, as a practice, build in certain supports for an outpatient level of care, and sometimes what we call an outpatient plus level of care if needed. We have an office in Manhattan, in Long Island, and we also do a lot of virtual work. We have licensure in a lot of different states. And so we're able to kind of bridge not only the New York area, but as Florida and California as well, and some other states. You know, as outpatient clinicians, we've been able to be in this conversation in many ways over different forms for many years. And I know some of you on the panel have already kind of disclosed your affiliation with veganism. I'm not a vegan, but I am somebody who really, really cares about recovery and really supports people's path, their spiritual path and their recovery path, and really here to listen to folks as they're recovering and to create a little challenge in that conversation. And that does happen in nutrition private practice work as well. I'm also an author. Jenn and I actually have we both have published books from Routledge. And the way we connected, which is really interesting, was we wrote a blog on integrated eating, on veganism and eating disorders, kind of like starts part of the conversation. And Jenn reached out to me and said, you know, hey, can we, you know, use, Jenn, did you use it in the book? I think you did, right? Okay, so so I think it's been really amazing to be on this side of the clinical work and to facilitate these challenging, important conversations from all sides. So I'm really happy to be here.
Thank you, Maria. And next will be Taylor Wolfram. Please introduce yourself.
Hi, everybody. I'm so happy to be here. This is
That's a different.
such an important topic. My name is Taylor Wolfram. My pronouns are she, her, and hers, and I'm a registered dietitian based in Chicago. I run a virtual outpatient private practice, and we specialize in anti-diet, vegan nutrition, eating disorder recovery, intuitive eating. We also work with non-vegans, but everyone at my practice is an ethical vegan. I've personally been vegan for about 14 years. I've been involved in the animal rights space, and I've also experienced my own periods of disordered eating, both as a vegan and as a non-vegan. And I'm just really passionate in particular about combating diet culture within the vegan community. Let's see, I'm also a certified Befriending Your Body teacher, which is a somatic skills program specifically for people recovering from disordered eating. And I found myself in the professional eating disorder space after I made the transition to becoming a weight inclusive practitioner and seeing just how much need there is for compassionate eating disorder care, especially for vegans. And I'm so grateful, you know, for folks like Jenn and Maria and Lisa and, you know, everyone else who is really just moving things forward to help ensure, you know, access to quality, you know, care for vegans. I've created an online course called the Anti-Diet Vegan Nutrition Online Course, which is a place for people to go if they want to learn about vegan nutrition. That is totally free from a lot of the typical diet culture restrictive kind of advice, unfortunately, that tags along with vegan information online. I also do some writing, speaking, blogging. We run some support groups at our practice, and we're pretty active on social media too.
Thank you, Taylor. Thank you to all our panelists for your introductions. What a great team we have here today. Okay, so we're going to jump right into the conversation part of this event, and the conversation for now will be focused on our 4 panelists having a conversation with some questions and prompts that we had prepared. So for now, this part of the event will be just between our panelists, and After a short break, a little bit later, everyone will have an opportunity to ask questions and join the discussion. So we're going to start with definitions. So we're kind of all on the same page about what we're talking about. Let's start by highlighting the definitions of veganism and eating disorders. These definitions will provide a foundation from which to discuss the topic in greater depth. So we'll start with veganism. According to the Vegan Society, veganism is a philosophy and way of living which seeks to exclude, as far as is possible and practicable, all forms of exploitations of and cruelty to animals for food, clothing, or any other purpose. And by extension, veganism promotes the development and use of animal-free alternatives for the benefit of animals, humans, and the environment. In dietary terms, it denotes the practice of dispensing with all products derived wholly or partly from animals. I just want to ask, if you're not muted, if you could please mute yourself. Let me see if I can do that. Okay. Okay, so we have our definition of veganism. Now we'll continue to feeding and eating disorders, and this definition is from the DSM-5. Feeding and eating disorders are characterized by a persistent disturbance of eating or eating-related behavior that results in the altered consumption or absorption of food, and that significantly impairs physical health or psychosocial functioning. The DSM-5 provides diagnostic criteria for the following eating disorder diagnoses: pica rumination disorder, avoidant restrictive food intake disorder, anorexia nervosa, bulimia nervosa, and binge eating disorder. So we have our definitions pinned down, and I'll jump right into our first prompt question. Now that we have established some basic distinctions between eating disorders and veganism, let's explore differences in etiology and causality in each phenomenon. What are some qualities that are unique to eating disorders and eating disordered individuals? What are some qualities that are unique to veganism and vegan individuals? What might contribute to and sustain veganism versus an eating disorder? So I invite the panelists to jump right in.
Well, this is Lisa. I can jump in a little bit just to get the party started, as they say. So I think for vegans who are not motivated by an eating disorder, they are more willing to and encourage and enjoy different sorts of higher calorie foods in their diet. They might enjoy, fats of all kinds, and not have shame or guilt around eating them. So things that are vegan that may fall into that category could be things like nuts, walnuts, and then we have avocados, other items, tahini, different things that bring in and help to provide like these sorts of fats in our diet that we need for various reasons.
I was going to chime in by saying, the word that comes up for me is rigidity, right, versus flexibility. And I think really kind of echoing Lisa, that the difference between is the intention, yeah, and the energy that is going along with the dietary choices. And I think rigidity sticks out to me or stands out to me. We have people who have, I sometimes like to take it away from the actual topic and just think about it in general, right? If somebody has an allergy to nuts, they have to be rigid with their positioning for various reasons. but it doesn't necessarily mean that they're not flexible in other places. So I think for me, what stands out is flexibility and rigidity, and those two words, and again, of course, always intention.
Yeah. Oh, Taylor, you can go ahead.
Yeah, though I agree with everything Lisa and Maria have said, and looking at kind of a bigger picture, for me, veganism is about you know, a drive for change, focus on systems, society, compassion, and it seeks to reduce suffering, right, through liberation, through body liberation of non-human animals, whereas eating disorders tend to be all about, you know, fear of change and growth and intense focus on the individual rather than the systems, you know, wanting to stay the same. And, you know, eating disorders, we can't pretend they're a monolith, right? And that they all have the exact same characteristics, because they don't. But for those, you know, where body image, focus on appearance and physique may be a big part of them, you know, I see that as a key differential here, because body liberation truly is at the root of veganism, whereas eating disorders, it's the opposite, right? It's about control, judgment, you know, really there is no autonomy for the body with eating disorders.
Yeah.
I'm gonna chime. Oh, sorry. Was somebody talking?
Oh, was just gonna echo kind of what, no, just echo what's been said, and really kind of just add to that. You know, I think veganism is about a forward motion. I think, you know, I think Taylor, I like the word that you use, stuck, or, you know, kind of, you know, and others have used the word rigid. I think it's about, I think for eating disorders, it is about this, you know, this kind of this paralysis, this sort of emotional and even physical paralysis, where to a degree where, you know, you're staying still, your world is very small, your world is very contained and very channeled into this eating disorder vice, this eating disorder tunnel that, you know, that you know, is the day-to-day, and there's a real resistance to moving forward and to kind of to having motion, to having forward movement, to thinking outside of the box, to challenging oneself. And there's a real, like, when I imagine it, I just imagine like a tightening, and no matter what the eating disorder is, what type of eating disorder, even whatever the behaviors are, there's I still imagine this constraint and this tightening, and not, you know, whereas, you know, this kind of closedness, whereas with veganism, there's, you know, there's sort of an expansiveness about it. There's sort of an openness and an exploration about it, because, you know, and as Taylor said, it's this, like, the body liberation piece of it, you know, for non-human animals, very, there's so many questions come to mind. There's a curiosity about it. There's, okay, how, you know, like, I imagine, just like I say this a lot in different contexts, but like, I imagine open palms up, rather than palms clamped down and facing down. Like with eating disorders, there's an expansiveness and openness, of forward movement that isn't held back by fear. And I think that's a great thing to say too. I know Taylor and a couple others might have said that as well. Like, there's fear behind the eating disorder. It's what's keeping you locked in place. And I think there may be frustration when it comes to vegan issues and other things like that, but I don't think it's the same type of fear that exists for an eating disordered person that keeps them there, that keeps it sustained. So that's my take on it. But yeah, Maria, please. Yeah.
I was just going to chime in yoga therapy. One of the yamas, one of the tenets of yoga therapy and yoga philosophy. In fact, the first yama is ahimsa, non-harming. And like Taylor said, right, there's a difference between eating disorders, which ultimately harms. We have to also remember that we technically and through classification are also animals. And so when we're thinking about non-harming, and this comes up a lot in recovery talk, are we harming ourselves through the eating disorder? And one of the most basic pieces of veganism is non-harming. And so perhaps ahimsa, or this idea of practicing non-harming of life, is part of what is different between an eating disorder and veganism, right? That's one of the things that can be really, really, I don't know if it's opposite, but I certainly think different and questionable.
Yeah, I would agree with that. This idea of being loving and forgiving towards ourselves is really part of that. In the vegan culture, we do talk about being kind to one another as well. that is really important. It's all part of being vegan, which is really expressing, compassion and love for all life, and just including animals in that, so that we don't exploit or hurt them with what we do, what we choose to do. And it's very possible to be vegan and enjoy all sorts of delicious and yummy, nutritious and maybe not so nutritious foods, while also being, kind and upholding our ideals. So I think for vegans, we do hold those ideals as a spiritual practice. And so sometimes that may appear as being rigid, although it is, I believe, part of our dharma, part of our path. And so it's trying to discern where the rigid places and how can they be, what are the nuances there? Like, for example, saying, well, I won't be compromising on eating animal products, but maybe I'm going to have something I don't usually eat because that's what's available. It's not my favorite thing, but that's okay. I'm choosing to make my choices, based on my values. And so that maybe my preference, or my ideas of, what is nutritious may be a secondary priority.
Lisa, I thought of you when Maria was talking, because I know in my mind, I'm like, oh yeah, there's so much overlap. I'm so glad that you just talked about that. And I love that focus on compassion and values. And I think to that end, I think there's a real distinction to be made in terms of veganism. We're talking a lot about the food piece of it, but it's a way of life. It's a way of living. That value is practiced in everything that you do to the greatest extent, just like was reflected in the definition of veganism, as far as practicably, I'm fudging it up, but the practicable possible part of it applies to everything, and not just food. And we do what we can, in all areas of life as much as we can. And that's not to say that we're aiming for perfection, but we try to, use the resources that we have to really make it as possible as it can be. But yeah, that's that value, though, that's mirrored in all aspects of life, not just in the dietary component of veganism. I think that's where a lot of people sort of go there first, including myself. When I think about veganism, I always think about food first, just the vegan diet first. It just is so automatic, because that's so often, that's just what's you eat throughout the day. It's just such a familiar thing. The whole thing about, people go vegan, the biggest deal, is really changing what you eat. I mean, I think more than anything, and people do tend to focus on that, but it's also important not to lose sight that it's a value system reflected in every area of life, whether it's the clothes you wear, or whether your shampoo was tested on animal, like things, just really anything, and to have an eye for that and to practice that, in all these different areas. So that would be another distinction for me.
And one more thing about ahimsa, the translation that I know of is dynamic harmlessness, and it's the idea is to do the least amount of harm. And sometimes, we have to choose in that situation. And I think that's where the flexibility comes in as well. It's not about this idea that it's perfect, but you're doing the best you can in the situation that you have.
And Lisa, in just kind of tagging along in recovery, when we really bring that into the conversation, right, which is the least amount of harm. And when we bring a spirit of compassion, we bring also a spirit of exploration and being able to move and breathe with this question of how do I move through food and nutrition in recovery and still be gentle with myself and harm the least, right?
Maybe I wonder if now is a good time to jump into the next question. And somebody requested that I put it on the chat, so I'll do that so everyone can read it as well, but I'll read it out loud. And I think now we've talked about the distinctions, we're kind of now wondering, well, where's the confusion? So now that we have considered etiology and causality, on what levels of experience, conscious, unconscious, emotional, moral, intellectual, do we find intersections between veganism and eating disorders? Where might there be misperceptions? Like, why is this even a problem?
For me, the most obvious thing, unfortunately, is this what I refer to as plant-based diet culture, which is separate from veganism as, you know, an animal liberation movement as far as practicable and possible, you know, in all aspects of life, like Jen reiterated, is very different from eat this diet, also restrict all these other things like oil, sugar, salt, because you have intense fears about health or other things, and it doesn't apply. It's not about animals. It doesn't apply to other areas of life, but there is a big overlap of that. And even if you come to veganism purely as an animal rights activist, you will absolutely come into contact with plant-based diet culture. It's inescapable, just like regular diet culture. And so we have this force, right, within the vegan community pushing in ideas of fear and control and these patriarchal and white supremacist body ideals and this healthism. And so there is an overlap of restrictive eating, fear, perfectionism around food that people can fall into, and there can be an overlap with veganism. And I know we'll talk about a lot later about the importance of motivation and what brings people to veganism. And it gets messy when a lot of people have both ethical motivations and health or kind of disordered eating motivations. And so there is an overlap. And in my experience, talking with other providers, other dietitians, they see a lot of that. They see a lot of this plant-based disordered eating, just, among vegans and non-vegans. And so there's this assumption there that they are one and the same, or, oh, I hear the word vegan, I'm automatically going to assume that there's disordered eating there because I see it so often. And it might just end there, right? There might not be any more curiosity or compassion.
I think for me, there's two things that stand out. I think number one, when we're working with nutrition, one of the things that can come into play is how to adequately feed a body in general in nutrition recovery for any and all eating disorders, and then how to do it skillfully for those that have chosen a vegan path. So it can be challenging. I think we've come a long way in our field. I think we've come a long way in history of the world of just offering supplements that are more in line, foods that are more in line. I think we have the ability today. I've been in the practice for 25 years, and it was not always easy to find the ability to feed a body in recovery. So I think that's one piece, just from like the refeeding part, the balancing the parts. I think the second part is, again, being willing to have honest conversations with our clients about parts of them that might want to have a food that maybe is out of line with this decision, and how do they feel about it, and how are they allowed to explore outside of this box and maybe come back? And I've had clients that have made that decision. And I think finally, and this is a little bit like branched off to the left, as a trauma-informed dietitian and somatic practitioner, that we have to discern actually in the very beginning, or as we're working with our clients, as we're working in the field of recovery, what is trauma-based? What is recovery-based? What is sensory-based? When somebody is just telling us about their diet, and they may not even use the word vegan, they may not be coming from that positioning, but they may be coming from a sensory or trauma-based decision. And so we want to understand their motivations a bit more. We want to understand where are they coming from, why have they made choices, and how do we support them in their recoveries to find their way. So I think those are left and right and in the middle kind of things.
Yeah, I love what you were bringing in about the different alternatives, because there's so many these days. Even just for people who are vegan, you'll hear that, yes, 25 years ago it was all tasted like cardboard, and now we've got all these different, alternatives, and that makes it much easier for people to stretch themselves a little bit with veganism. If they do have an eating disorder, they can then try some food that possibly elicited fear, and then see, okay, here's a vegan version of that. What would that look like? So I think that provides more alternatives for within the field. And I also think sometimes, and I'm so excited to see many vegan nutritionists out there, because I think there have been, maybe there was some confusion early on with some nutritionists who didn't understand what veganism was. I know at the time when I was at the Renfrew Center, the vegan option was tuna fish. So that was surprising to me. And another fellow therapist had said, well, a friend of mine who's vegetarian eats tuna fish. And I, was kind of in a stuck spot because I didn't want to offend her, but I, from my understanding, eating an animal is not, vegetarian or vegan. So there, sometimes it was just some education, I think, for having within a larger facility or staff, having the existing nutritionists understand what veganism is in general, just really in general, so that the alternatives provided can actually be within the value system of vegan. And now, thanks to a lot of wonderful alternatives, it's a little bit easier to do that.
I'll say both Maria and Lisa points that you brought up. Even today, I've had clients, who have gone to a higher level of care, and I've had to consult with their, PHP residential dietitians, because they just don't know how to create a vegan meal plan, or their exchange system just isn't easily translatable to veganism. And it seemed so obvious, right, to me, and it seemed so easy, and maybe it even does to the client, and they're trying to advocate, to their providers of treatment. But yeah, there is, even if things are more accessible nowadays, whether it's actual food supplements or just the knowledge, it seems like it's just still not where it needs to be, absolutely, among providers at higher levels of care. There's a lot of work to be done there in terms of the ease of, supporting vegan patients and clients with an appropriate meal plan. I wish they were all like Alsana, of course, have these beautiful, robust vegan programs, but even treatment centers that don't, right, there could be a lot more done in terms of just training and the flexibility of meal plans and the systems they use to help people nourish themselves.
It would be wonderful to have the sort of training at the maybe conference level for practitioners of all kinds, so that and part of it would be some myth busting also. I think that to assume that somebody who's vegan has an eating disorder, when we can see from our conversation, there's so many nuances, and then to help people who are providers with some of the information they need to create these treatment plans for everyone.
Yeah, because I do think that there is misunderstanding that can happen in a couple of different ways, at least a couple of different ways. And I think that it's important to kind of establish sort of as a baseline. For me, I find it important to find where the misunderstanding can lie, if it does in fact exist. You know, where might we find it? And to me, that's in the automatic equating restriction from an eating disorder to vegan eating, to eating a vegan, we'll just use quotes, diet, but a vegan diet. So there's the automatic equating the vegan diet to the eating disorder restriction and assuming they're one and the same, assuming that, as Taylor said, you know, if somebody says, you know, I'm vegan, well, that must mean, you know, that must be a part of your eating disorder. I'm paraphrasing kind of what you said, Taylor, but it's sort of this assumption that it's a part of the eating disorder. And I think there's that. And then I think there's another piece of it where I think even if there is a belief that the person is in fact ethically aligned, ethically motivated, fully, you know, really like being true to their values, that it's not realistic for them as an eating disordered person to recover as a vegan. Like, I think that is almost just it's just another lens to look at it through. It's like, you know, and so I think both of those have to be talked about and kind of gotten to the bottom of. And I think I think it's also important to sort through some of the reasons these misunderstandings exist in the first place, or I'll say like assumptions, or maybe the automatic nature of the assumptions, the quickness of them. I think a lot of that is, and I don't have like studies that I'm looking at the moment on the screen, but there's been research done that's clumped vegans in with vegetarians and pescatarians, and almost like Lisa, like you're saying, the tuna fish counted as vegetarian. Like, a lot of the research was reflective of that, or maybe that, you know. So I feel like the way that this plays out, whether it's in treatment or in other parts of society, it's not entirely separate from the way the research has been presented and kind of what is being used, what is being kind of drawn from to put forth certain sentiments or beliefs or statements. Somebody might really feel a certain way, but it's because they've maybe, you know, they've derived that from at least in part. And I think there's something to be said about the fact that the research is what it is and has certain flaws, and then that does infiltrate into the mainstream perception in a lot of ways, including eating disorder treatment.
I think this is a good place to just jump in with, because this is on topic, our third prompt. What are some ways we as professionals might consider a patient's motivation for veganism? What significance does this motivation hold? So we're touching on this topic, so keep going.
I told Jen at some point this story, so I think it might be an interesting, possible interesting conversation to continue. I worked with a client. I have worked with clients, but specifically this client who I don't actually know was motivated 100% by their morals. I wasn't 100% sure. And one of the reasons why I wasn't 100% sure was because there was an over focus on the food, but an under focus in other areas, right? And again, there's no judgment. I wasn't judging a person for having a leather bag and wearing leather shoes, but there was a discrepancy, I believe, in what was going on in the higher level of, like, where it was coming out was the focus on food. And so what we did as a team, the clinical team of the nutritionist and therapist, is really bring in these conversations, again, without judgment and with really a lot of curiosity around, tell me more about your motivation for this and that, and really to be able to parse out what was what. So I think it's an important story to bring in.
Yes, that is, I think, very important to understand the values. And yet, as a person makes that transition into veganism, they may do it in a way that is not a black or white, one extreme or the other. They may not be suddenly, they might have transitioned in their food, but maybe they haven't transitioned in their clothing yet. Maybe they haven't gotten to that part of their journey. So I think it's interesting to have those conversations and just to start. And as you have those, you might discover the person finding, oh, well, yes, that does make sense. And that is part of the next step in their journey. Or if they reject it, that would give you some really valuable information for treatment.
Yeah, and Maria, I just love what you said. Tell me more. I mean, and there's so much you could do with that. And there's so much, it's such a non-judgmental sentiment to put forth, with a patient or with, us here. It's just tell me more. It's an open stance, a curious stance. You're not judging either way, in any which way, and just real. Those words carry a lot. It's tell me more. I mean, isn't that what we do anyway in therapy and nutrition? I mean, just tell me more. Let's talk about it. I'm not coming in with a pre-formed conclusion here in any direction. I just want to know about you and what's going on and how I can help. And I, might not be so apparent right away. And I think, like Lisa, like you're saying, it's not necessarily going to be black and white or even kind of have a sense of certainty about it. And there might need to be more questions asked over time and different kinds of questions. And I'm sort of roping everyone in here to my 2 cents, but I know, Taylor, I can let you talk about this, but you have, an assessment that you use that can really kind of get into some of the details of, some of the nuance, and people have different assessments, different, and I know, Tammy Beasley, Eleni Rogers from Alsana, they have their assessment, but there are ways to talk about it. But I think, and talking about it, tell me more, check in a little bit later, a month down the road, a week, whatever it might be, in certain increments. Where are you at now? Where are you? How can I, and then how can I be supportive? And let that answer be informed by what the patient says, and also what you know about the patient and what you know of the patient and what you know about eating disorders and veganism, and which is why, those in-house trainings are so important. And we can't always just believe everything somebody says at face value, off the bat, but it's a collaboration. That's how I see it. It's a collaboration, ongoing collaboration.
Yeah, I agree wholeheartedly. It's not just why are you vegan, right? And leaving it at that, the curiosity, but also ongoing, right? As we know, people can carry a lot of shame, right, about their issues with food and eating, and it takes time in a therapeutic relationship for a lot of the details and truths to come out. And so even if there might be some disorder wrapped up into the veganism, that might not come out right away, and that's common of so many things. And so, like Jenn said, kind of that ongoing checking in, and just, it oftentimes will come out as the trust and rapport is built. But I think part of this question is, why is that motivation so significant? And Jenn mentioned earlier, she touched on the research, which overall is very, very limited. What we know about vegans and even some of the assessment tools that are out there are questionable in terms of how valid they are for vegans. But, the research decades ago lumped everyone together, right? I remember there was that one study in the 90s that said, like, young college-age women who are semi-vegetarian are more likely to have eating disorders. And that really caused a big fear of anyone along like the vegetarian vegan eating spectrum among eating disorder practitioners. In my experience talking with folks, I think that was a big source of the bias and fear. But now the research is getting a little bit better. the studies that we do have that tease out the motivation for vegans looks more at orthorexia, so not clinical, eating disorders, but we do find that there is a pretty significant difference between folks who are ethically motivated vegans, tend to have a significantly lower, risk of or show behaviors for, scoring on these orthorexia assessments than folks who are come at plant-based eating for health reasons. And so that's not to say, oh, if you eat plant-based for health reasons, that means you have an eating disorder, that you're going to get an eating disorder. Absolutely not. But, we're on to something here. And I know that we see it in clinical practice too. And so that also is another reason why, these motivations are so important.
And yet you might also have somebody who has that ethical motivation and also struggles with body image issues and other things. So there could be, a person who is ethically vegan and really needs some support for the body image and eating disorder types of tendencies.
And I think that's a good segue also to our next prompt. In her book, Veganism and Eating Disorder Recovery, Jenn proposes a model for a vegan-informed approach adapted from the existing trauma-informed model. Principle 11 of this approach is use a strengths-focused perspective, promote resilience. For example, a professional might consider asking a vegan eating disordered patient, what is practicably possible for you as a vegan? What might a strengths-focused or resilient approach look like for a vegan person with an eating disorder?
I'll jump in and share a story just to get us started. A client I had a few years ago who was just really struggling, with her eating disorder, was in and out of treatment at all levels of care. And one of her primary motivators was her dream to start a farm animal sanctuary one day. And that was so strong for her. She was an ethical vegan who also had an eating disorder. And she had this dream, of really wanting to live out her values and really help animals, aside from her eating habits, right, to be able to start a sanctuary. She also cared for a lot of rescued animals that she had adopted, and she really worried about their care when she was in treatment. And so that was also a motivator for her to stay out of treatment so she could care for her animals. And so I think, a lot of times for people who are really sick, their own health, right, and wellness may not feel like an accessible motivator. But for ethical vegans, sometimes looking at the activism and how they can help animals and how they can do so much and so much more when they're well, right, and as they continue to be well, that can be a really strong motivator. So that's just one part, and there's so many other things I could say about this question. I love this question, and I'll stop there. But I think that's a really beautiful kind of illustration of how, veganism can actually strengthen recovery for some people.
Well, I agree with that. And I'll just share that one thing when I was working with different patients, not necessarily vegan, all kinds, one thing I found was that people who had a passion of some kind, that helped motivate them towards their recovery. And so veganism is a passion. It is a passion for many people, the animal activism part of it, trying to help animals, trying to prevent exploitation. And so it seems as though struggling with like spare time or extra free time, for example, if a person doesn't have a passion project in their life, that might be, how do I structure my time so that I'm mindful of my eating disorder? Whereas people who have a passion, they may have their time is focused often on, oh, I'm going to be doing this event or going to do this project or signing this petition, or these are things that I'm doing. So it could actually, I've talked to a couple of vegans who they felt that they recovered even better while they were becoming active as activists, in their animal activism.
So I'm going to take the other side of the coin here, right? Because in recovery, there's two parts. There's the clinical team, if you're working with one, and then there is the vegan in recovery. And so I believe that we as clinicians need to stay open-minded and understanding. And if you have a clinical team that is willing to say, tell me more about this, or let me understand your motivations, it becomes more strength-based on both sides. And if there is a team that maybe has their own understanding or limitations around the subject, it can get in the way.
Yeah, and I think there can be, not to dive into too much of the negative here, but like it could be very damaging when a lack of understanding gets in the way. There are real repercussions to that. And I may be veering a bit here, but like if, somebody who doesn't have, who is vegan, but who's, in treatment where for any number of reasons, they can't have vegan or a fully vegan diet and treatment for any number of reasons. The fact for them remains that they're vegan and they're having to, eat meals that are totally out of alignment with what they feel they can tolerate, and in a very vegan specific type of way that may not be about their eating disorder. And so just bringing back the support piece of it, it's so important to have that built in to treatment, to have that understanding, so that people can be helped, even if it's just about feeling understood, even if they can't have vegan food, at the very least, how can we almost like prevent further damage from happening here, so they don't feel even worse. Recovery is hard enough. We don't need to, we can try to, hold them where they are and align with them as much as we can, as much as we feel able to. And what is that? How can that happen? And, but yeah, but also just to kind of speak to the passion and the life piece of it. There's a philosopher, I mentioned him in the book, his name is Eugene Gendlin, and he talks about it having a drive for life. And one of the quotes I think I read of his was, what might it be that points toward more life? I don't think I'm saying that verbatim, but really finding that path, and so veganism, it really can be something that is life-driven, something that is, and then kind of circles back to the very first question of the distinctions in terms of, the veganism is just inherently life-driven. And if we can identify that and lift people up in that regard, whatever that may mean for them, kind of bringing back in the assessments piece and all of that, and the motivation piece, if we can really meet them there and lift them up and have an open stance and a forward moving stance with them from that place. I mean, just think of how they might thrive in recovery. I mean, and how they might seek out, even in challenging situations, even in situations where maybe vegan options aren't as available, they might actually be motivated to make it work because they want to be recovered. They want to be a vegan in this world, living as a vegan, fully recovered, and it might be worth it to them. So they might want to seek out resources. How can I make this happen? And if they can be met there, then they could possibly understand their own potential in that way.
Yeah, and I think one thing that you mentioned that I think is important is also about, there's a lot of inner conflict going on when a person struggles with an eating disorder, but there's also like a conflict of values. And when a person is put in that place, it causes like a huge inner struggle. If they're now having to look at their values and also their other eating disorder voices or struggles that are happening inside. So it seems like removing that conflict of values by needing to eat something non-vegan would at least help them just to focus on the eating disorder piece of it. That's one idea. if the person is truly committed to those values, and that's, through the assessment and conversation, that's what's decided. Because it may actually be traumatic for some people who are vegan, who are ethically vegan and spiritually vegan, to then have to eat something non-vegan when it's against their values. And that seems to be, when we're talking about this trauma-informed lens, and then in recovery, you want to be supporting this strength model rather than adding another layer of trauma onto it.
Yeah, absolutely. And I know Jenn talks about that in her book, in her personal experience. I've never gone through that, but I can only imagine, right, how extremely traumatizing that would be, and how I would really just need to dissociate to even do that, right? It would just ruin my mental health even more. And so, yeah, ideally, right, if someone needs to consume non-vegan food as a part of their recovery, hopefully that is a collaborative decision, right? And that the patient or client's autonomy is a priority. We know that's not always the case. But in any event, I think really just validating the veganism, the person's values around animals, and still remaining curious, still talking about that, right? Not just letting the conversation end at like, well, you can't eat vegan treatment, right? And talking with them, like, what are some non-food ways that you feel passionate about helping animals? Like, is there a capacity for you to increase any of that, while, the food part is, we're kind of working through that with the eating disorder. So you're still really affirming those values. They're still able to, live out that part of them. I think that's so important, rather than just, saying like, oh, veganism is off right now, because food is just one very small part of it. And, as far as is practicable and possible, okay, maybe that doesn't include a 100% plant-based diet right now in this stage of recovery, but that doesn't mean that you can't still, help animals in so many other ways. So I think keeping those conversations going really shows that as providers, right, we care, and that we do understand what's being taken away from them and how much that can hurt them, and that we still care, and we want to help support them to, live out their values in other ways.
And I think that means a lot to vegans. I really, really do. I really think that it means a lot to hear somebody say, look, we might not be able to do it exactly the way you see fit at the moment, but we hear you, we see, we're going to do our best to work with you. We understand and recognize why this need is so important. And I think personally, just, as a vegan, but I don't think I'm alone in this. I mean, I think a lot of vegans would really appreciate that, like genuinely appreciate it, and almost be willing, to work with that in ways that, maybe in another scenario there might have been more resistance. I really do. I think that it can be. I think there's so much room. There's so much capacity for understanding, and for I don't know, just for growth. When you know that you're being met there and you can feel it, I think that really means a lot to a lot of vegans. I really do.
I agree. I also think it's a good time for us to encourage the teams who are helping to really seek out these vegan friendly treatment options, nutrition-wise and otherwise, because we know it is possible. And even though it may not, there may be extenuating circumstances, medically and other things that, do come up. But I think that this is a perfect opportunity to meet those needs with, here's some meal plans that are fully vegan, that actually do contain all of the nutritional needs that you have, and that will support your values and can help people to feel that they can recover while being vegan.
And here's just to piggyback on that. Here are some ways here are some things we might implement in our program. You know, when we think about things like cooking groups and restaurant outings, here are some ways that we might make it a little bit more or a lot more accessible for vegans to partake and also challenge themselves in, you know, eat food challenges just the same as everyone else needs to be challenged with food. But here are some ways we could do that. And let's, you know, just, yeah, let's explore that. Let's explore it on an organizational level as well as an individual level. How can we rethink some of the ways that we might run our program so that we make it more friendly to the vegan who will benefit if there's that kind of a challenge. They absolutely will. Their recovery will benefit. So how can we help make that possible for them?
I just want to note that we would like to take a break in a minute. Any last comments before our break from the panelists? All right, I guess we'll break now then. So how about we take a 6-minute break? It's 2:14 now, and we come back at 2:20, and we'll keep going with our Q&A and interact with our participants. So we look forward to that and see you all in a few minutes. Thank you for the panelists. Thank you so much for your conversation and your expertise and your thoughts. See you in a few.